Hey YouTube, I am Dr. Daniel Kaplan, and my mission is to make psychology accessible to all. In today's video, we're going to talk about the concept of a psychological disorder, but we're not going to talk about it through the traditional lens exclusively. We're going to also talk about what it means to have a psychological disability or disorder through childhood and adolescence. A psychological disorder is traditionally defined as a pattern of behavioral, cognitive, emotional, or physical symptoms that show some level of distress, disability, or an increased risk for further suffering or harm. What is it? What do I mean by distress? Distress refers to that the person is bothered by whatever condition they're struggling with. Now, in some cases, person may lack the insight of the distress, and we would look at the distress caused to other people around that individual. Disability, when we talk about the term disability, this means that in some aspect of life, that individual has been hindered. So it might affect one's ability to study in the classroom. It might affect one's friendships. In adolescence and adulthood, it might affect working relationships or how one gets along with their coworkers. It could affect one's legal status and so forth. So disability refers to some level of impairment in one of the domains of functioning. And then when we look at harm or suffering, we generally believe that without treatment, most people are going to have their systems exacerbated. So therapy actually helps reduce suffering, reduce some of these difficult symptoms. Now, harm could also be, in addition to the emotional harm, it could be self-harm in which a person might be suicidal. It could also refer to harming another person or homicidal ideations. And that's extreme. The vast majority of conditions do not have a risk for self-harm or harm to others, but some do, so I wanted to bring that into the mix. Now, understanding one's impairments, that should be balanced with whatever the unique situations the individual is faced with or the environmental or situational circumstances before determining a disorder. So we do have, and we've been working to try and reduce this, but we do have mental health stigma. It remains. It is oftentimes the case where people will avoid seeking treatment because if they're diagnosed with a mental health condition, they might perceive themselves as quote unquote crazy, or they might worry about what other people perceive them to be. But what I want to do is I want to bust this myth. The vast majority of psychological disorders do not include psychotic states. For example, would you label someone who has anxiety as psychotic? Would you label someone with ADHD as psychotic? Would you label a person who has an eating disorder as psychotic, and so forth? So as you can see, the vast majority of psychological conditions do not include psychosis. And because of that, the myth that having a psychological disorder is synonymous with insanity or being crazy or whatever the stigmatizing language a person uses, it's not true. So one thing that we recommend is try to separate the child from the disorder. In the American Psychological Association, we try and emphasize person first language. So we might say a child suffering with panic disorder versus panic disordered child. And that subtle difference in language means something. When we say a child suffering with a panic disorder, the emphasis is on the child as a whole, the child as a person with dignity. But if we say a panic disordered child, that qualifier becomes the emphasis, and we're pushing the diagnosis rather than who the person is. Now, we also have to understand that problems could arise when children are trying to adapt to atypical or unusual circumstances. And there is this general phrase that abnormal behavior can become normal in abnormal circumstances. So we have to understand the circumstances as well. Now, as a framework for diagnosis, though, we use the DSM-5. It's now in a text revision, and its purpose is to allow us to use a shared language that helps us describe or organize features in a person's behavior or emotional response set or their thoughts and so forth. So the DSM-5, as it says, implies that there was a DSM-4, 3, 2, and an original DSM. And I think that's important to understand because the DSM is in constant evolution. And the conditions that are included or excluded are determined solely based on the state of the research at that point in time. So, for example, if we were to look at a condition like obsessive compulsive disorder has sufficient research backing to justify its inclusion. Whereas when we look at substances of abuse, the concept of a caffeine use disorder has not been included to date. It is listed as a condition for further study, which means that there are some people who are suggesting this should be included, but the state of the research is such that there isn't enough evidence as of yet. We also remove conditions from the DSM if the research suggests that we missed the boat. For example, homosexuality was listed in the DSM up to the DSM-3. With further research, we realized that the dysfunction, so to speak, or damage to one's ability to function in society or adapt, that part was not there when we looked at homosexuality. So it was removed. So the DSM is constantly in evolution. One of the things that is really nice about the DSM-5 and its predecessor, the DSM-4, is that there is a greater emphasis on the research, but also there's an emphasis on cultural variations. And putting an understanding before we label a person with a diagnosis, we want to make sure that the condition is not some kind of culturally appropriate set of behaviors. So you will see in the DSM-5 a larger discussion about cultural variations. So that is a very brief discussion of the DSM-5. Now, when we're looking at children and adolescents, in order to determine one's ability to function appropriately, we have to evaluate a concept of competence. Now, competence refers to one's ability to adapt in their environment. And we do see certain factors impact adaptation. So, successful adaptation is influenced by culture, ethnicity. People who come from underrepresented ethnic groups struggle with a series of environmental factors that other people may experience to a lesser degree. Things like racism and prejudice, discrimination, oppression, and segregation. All of these factors can impact one's ability to adapt to one's environment and can impact the proper development of a child. So we do look at various developmental tasks, and we ask ourselves, has this child mastered the knowledge base they're supposed to? Their behavior, is it in line with the expected conduct and the self-awareness and so forth? So these are a few aspects of development and developmental tasks. To add a little more flavor to it, though, I want you to see some of the basic developmental tasks across several aspects of childhood and adolescence. So if we were looking at an infant up to the preschool years, our focus might be on attachment. Did the child develop a strong emotional bond with their caregiver, right? Language. Is the child speaking to a degree that they're supposed according to their age? So a speech and language delay can be detected as early as 18 months, right? Because we expect the child to be saying their first few words at roughly 12 months, and so forth. So moving to middle childhood, things like academic achievement, school adjustment, getting along with one's peers, these become developmental tasks during the school age years. And then adolescence, you have the adjustment to secondary schooling, the emphasis on extracurricular activities, and figuring out one's identity, figuring out who one is. So if you were to talk to Erik Erikson, he would say teenagers go through an identity crisis where their whole focus is trying to figure out, who am I and where do I belong? So like normal individuals, people try out different versions of themselves till they figure it out. So these are just a few examples of developmental tasks across several aspects of childhood and adolescence. So if we were to look at what might cause an eating disorder or a mood disorder and so forth, we believe that there are two general developmental pathways. The first pathway is what we refer to as multifinality, which means that similar origins can result to different outcomes. So if a child experiences a lot of fighting in their home with their parents, that could result in a mood disorder, an anxiety disorder, conduct disorder. It could result in normal development as well. So similar beginnings could result to different outcomes. So if you have 1,000 children experience fighting with one's parents, like I said, it isn't going to cause just one outcome. We also understand the principle of equifinality, which is having similar outcomes coming from different early experiences. So if we were to look at depression, major depressive disorder, there are several genes involved with depression. There are several neurotransmitters involved in depression. Certain family characteristics, such as divorce and exposure to domestic violence, are factors associated with a mood disorder. And an environment like being raised in poverty or being exposed to gang violence, immigration, things like that, these environmental factors could also lead to depression. So the 2 points from the slide is the same beginning could lead to different outcomes, but there are many factors that could lead to a common outcome. These are the 2 principles. And with that, I'm going to stop the lecture. I hope you found this useful. So one of the differences when trying to come to a diagnosis with children and adolescents is that we evaluate competence. We look at how the child is functioning relative to their developmental tasks. How are they performing relative to what we expect of them based on their age and so forth. It isn't just about the D's of, and I know this wasn't on the slide, but deviance, distress, dysfunction, and sometimes danger. It's about competence as well. So I'm going to stop the lecture here. I hope you found it useful. If you found it useful, give me a big thumbs up, hit the like button, subscribe, click the notifications tab. This is how YouTube evaluates the video and evaluates whether they should push it out to a larger audience. I thank you for your time. Until next time, take care, everybody.